Cuba is known the world over for its ability to train excellent doctors and nurses who can go out to help countries in need. As of 22nd of October, a delegation of 53 Cuban health workers arrived in Liberia to help fight the Ebola outbreak.
Once we hear about the situation of the spread of Ebola in these three countries of West Africa, so we decide to join the international effort to fight against Ebola.
The Cuban team consists of nurses, doctors, epidemiologists, and intensive care specialists. Having received an initial Ebola training in Cuba, all team members received a second training in Liberia on how to work in an Ebola treatment unit.
The first phase is where we really have more of a participatory lectures. We have small groups, we have case scenarios, and that lasts for 3 days. After that, then we bring the students into the actual mock unit. The mock unit has a lot of simulation to an actual ETU by having a low-risk zone and a high-risk zone. Just behind me you can see sort of the screening area where patients are screened to determine whether they fall into the case definition. There are suspect ward, there's a confirmed ward, and inside it we have expert patients who actually simulate scenarios that may be similar to ones that might be seen in an actual ETU.
And we are here receiving training about the use of the protection equipment, PPE, personal protection equipment, about how to interview patients, how to do the screening in the Ebola treatment units, how to proceed in cases of patients severely ill. So it means that we will be able, by the end of this training, we will be able to deal with any condition that we can receive in those units.
The Cuban delegation, as one of the first foreign medical teams to respond to the Ebola outbreak, will stay in Liberia for 6 months. They will work in shifts in smaller teams, mainly in the newly opened Ebola treatment unit located at the former Ministry of Defense compound in Monrovia.